Good morning. It really is. Thank you all so much for joining us this morning. We've come to the close of October, which is Breast Cancer Awareness Month. And what I wanted to try to do this morning is to focus um, on on women who are diagnosed with dense breasts. Um, uh, it's it's a worldwide campaign, really, to increase awareness and to promote regular screening and early detection of breast cancer. And then within that, we have the issue of, of what's happening with regard to women with dense breasts. And I'm delighted that we have so many folks here this morning to address the issue, including the mayor of Hamden, Mayor Garrett. We have Dr. Whitney Young, breast surgeon at the Whitney Imaging, the Breast Center and Mid-State Medical Center, Dr. Stacy Spooner, radiologist, Mid-State Radiology Associates, and my dear, dear friend, Dawn White Bracey, president of Sisters Journey. Like so many of us, this is personal for me. I'm a 36-year cancer survivor, an ovarian cancer survivor. And I always view that I am alive today because of the grace of God, but because of hardworking medical professionals, the power of biomedical research, but early detection, which is so critical. Let me just take a second, if I might. What is breast density here? It reflects the amount of, and I'm not a doctor, so I'll have the doctors address this, amount of fibrous and glandular tissue in a women's breasts. That means it's difficulty for the mammogram machine to see through the breast tissue and to identify any abnormality. And what happens often is if you are diagnosed with a dense breast, you'll need additional screening like MRI or an ultrasound to be able to detect cancer. And it's with a dense breast, it's so hard to tell the difference between dense tissue and a small tumor. So if you do not receive the additional screenings, then the tumor may be missed, and we know what the outcomes that may be. And what I wanted to do is to talk to you about some of these statistics with regard to, some people say, well, what's the incidence of dense breasts? And the issue is the denser a woman's breast is, the more likely she will have breast cancer. And that's why the early detection piece and the notification of whether a woman has dense breast or not is key. American Cancer Society, when breast cancer is detected early and is in a localized stage, 5-year relative survival rate is 99%. For me, there are two issues here. One is the notification that you do have dense breasts, and second is the insurance coverage in that instance. So women need to be informed by their doctor if they have dense breasts. If so, then additional screenings they must receive. What are the additional screenings they need to receive? And those screenings should come at no additional costs. They should be covered by insurance. More than 40% of all women over the age of 40 have dense breasts. Mammograms, once reviewed by radiologists, show how dense breasts are. They make it more difficult for radiologists to see cancer on a mammogram and obscure a cancer. Breast density is one of the strongest predictors of the failure of mammography to detect cancer. And this high breast density is a greater risk factor than having 2 first-degree relatives with breast cancer. So it's really, this is such an important issue. Anyway, that this is one of the reasons why I'm really so excited to be here with you this morning, and it's one of the reasons why I was so proud to introduce the Find It Early Act with my colleague, my Republican colleague, Congressman Brian Fitzpatrick. He is from Pennsylvania, and we introduced this early earlier this year. And what the legislation does simply is ensure that all health insurance plans cover screening and diagnostic mammograms and breast ultrasounds and MRIs with no cost sharing. And I was really so pleased that Katie Couric, everybody knows who Katie Couric is, and she has joined us because she has dense breast and ran into this effort. And she described this, I think, so appropriately. It's trying to, when the mammogram is with a dense breast, is like looking for a snowball in a snow field. And I think that that's a perfect description. She joined us when we announced we were reintroducing the legislation. She's had the courage to tell her story. It's a powerful one, and her voice helps to amplify our efforts in what we are trying to do. Early detection is key. 99% of women who receive an early breast cancer diagnosis survive. Our state, Connecticut, has led the way in requiring the information that women and their healthcare providers receive after a mammogram includes a patient's relative breast density and on the need for additional screenings to find breast cancer. And as I said, this was a question of notification and coverage. And Congressman Fitzpatrick and I, we have really been a tag team on breast cancer issues. We teamed up to introduce the Breast Density and Mammography Reporting Act, which requires the Food and Drug Administration to develop a nationwide standard for breast density reporting. Now, we introduced this in which is something that so infuriates me, and it has to be for the public as well as the medical profession. We introduced the legislation in October 2011, again in October 2013, and then we introduced it again in July of 2014, and then in February 2015, and then again in October 2017. And it was ultimately signed into law in 2019, which says that the provider has to let women know whether or not they have dense breasts or not. And that will go into effect next September of 2024, 2011 to 2024. The number of lives, we're not talking about buses, transportation, or helicopters here. We're talking about women's lives. And that is what an infuriating process. I say that because that's the frustration that I have. It takes us so long to do this. And as you know, because of the late Dr. Nancy Capella, her vision of a nationwide reporting standard will fully be implemented, as I said, next September. Less than a year to go. Now, what we now need to do is to mandate all insurance coverage, cover screenings, diagnostic mammograms, ultrasounds, MRIs, no cost sharing nationwide. It is imperative that all women, regardless of where they live or their insurance, have access to critical screenings without any additional costs. And I also know Connecticut has implemented no cost sharing coverage for additional screenings for those covered on plans regulated by the state. However, if you work for the federal government or at a large corporation covered by Medicare, TRICARE, or the Veterans Health Administration, you do not have this guarantee. So we need to pass the Find It Early Act, ensure the screenings are available at no cost to patients. I make one more point to you. I'm incredibly frustrated with the U.S. Preventive Services Task Force. They have made draft recommendations, I believe, that fail to recognize the value of supplemental breast screenings for a woman with dense breasts. Because of the continued inadequate grade, they grade, and first of all, I do applaud them because now they move the mandate, if you will, on mammograms to 40 years of age. It took a heck of a long time to get us to 40 years from the 50. And now they grade A, B, C, they go down the line. Now, if you have an A or B rating, insurance will cover the costs. So what they have done, they failed to recognize the value of supplemental breast screenings for women with dense breasts. And because of a continued inadequate grade regarding screening for women with dense breasts, insurers will not cover the ultrasounds or the MRIs that are more likely to find the tumors. So, and there already it exists a robust body of evidence that shows that women with dense breasts need additional screening beyond the mammogram. I've written to them regarding what I view as harmful draft recommendations that fall short of the science, that create coverage gaps, and generate uncertainty for women and their providers. And it exacerbates health disparities, which is why we need to pass the Find It Early Act, because this is about saving women's lives. And I said this to the woman on the phone. I said, you're going to tell me you're going to take another 10 years to figure this out? You know, and when you can do it now. There's so much research on this issue. So let's move to getting it done. And with your help and the voices of folks here, we will be able to do that. And now it gives me a great pleasure to introduce. Let me ask the mayor to say a few words. We're in her town. Mayor, please say a few words for us. And thank you so much for being here. And thank you for the great work that you do for everyone in Hamden. Let me take this off there so you can speak up here.
Good morning. Welcome to Hamden and Whitney Imaging. We're really happy to have Rosa DeLauro here with us today. Thank you so much for organizing this. I want to talk a little bit today about some of the health disparities that we have. Black women have the highest death rate from breast cancer. About 1 in 5 Black women with breast cancer have triple negative breast cancer. They have a higher chance of developing breast cancer before the age of 40 than white women. And at every age, Black women are more likely to die from breast cancer than any other race or ethnic group. We're trying to close that gap in Hamden. Just on Saturday, we had a mobile mammography van come to our Keefe Community Center where we were able to offer some screenings. We also have a garden of hope and reflection for breast cancer survivors in Hamden over at Town Center Park. Paint Hamden Pink has really led the effort on this. They've been around for 5 years, and it's a really great, wonderful group of people who are able to connect and build a community for breast cancer survivors. Hamden also lost one of the nation's biggest fundraisers for the American Cancer Society just in September, and that was Coach Dave Koch. He is a staple in Hamden for his fight for cancer funding and really one of the nation's largest fundraisers. But I also want to take a moment to thank Rosa for the really important message that she's sending. I've always leaned on the fact that I don't have cancer running in my family, which I'm incredibly lucky for. But I do have dense breasts, and so that doesn't make me adverse of all the risk. And so I'm going to make sure that I take care of my cancer screenings, and knowing that I have dense breasts, I need to go get an ultrasound. So I hope that was heard by everyone this morning. Thank you.
Thank you. Thank you so much, Mayor. And 2 points. I, too, have dense breasts, and I get the report, and I go and I get the ultrasound. And, yes, I can afford to do it. Many people cannot. Many women can't afford it. And therefore, they say, oh, my God, no, I'm not going. I forget about it. The other point that you made, which is another reason I'm angry at the preventive task force, is that the age is now 40. But, as you pointed out, with regard to Black women, that you're looking at the numbers, it's age 33, et cetera. So we need to look at the screening, and not have cookie cutter models for trying to diagnose and to detect breast cancer, and take this into consideration, because if not doing that, we only increase the health disparities. And please let me introduce Dr. Whitney Young, breast surgeon at the Whitney Imaging Comprehensive Breast Center and Mid-State Medical Center.
Thank you. Thank you for the opportunity to speak today, and thank you for your time. I just want to recognize and appreciate all of the strong work and advocacy that you've done throughout your career in the state of Connecticut and at the national level, speaking to this issue and breast cancer awareness at this timely month of October. We know that breast cancer in young folks, young patients, is rising. We saw that in a recent study published in JAMA that said that the rate of breast cancer in women under the age of 50 rose about 8%, in the last 10, 15 years or so. And so we know that breast cancer is unfortunately very common. We know that it's rising in young patients, and we know that screening is of paramount importance to detect cancers at the earliest stage possible, to afford the best treatment, the least invasive approaches to treating and curing women. And as you pointed out, the rate of cure for breast cancer is so very excellent when detected at the earliest stages. So really, these recent changes and recommendations to notify women is so important, so they can partner with their medical teams to obtain the appropriate screening recommended and known to be of use to save lives. So thank you so much.
Thank you for the work that you do. Dr. Stacy Spooner, radiologist with Mid-State Radiology Associates.
Good morning. Today, I'm honored to support the Find It Early Act reintroduced by Congresswoman Rosa DeLauro. Thank you, Congresswoman DeLauro, for bringing us together today and for your tireless efforts in saving patients' lives. So what we know is that screening mammograms are an integral part of preventative medicine. They are typically our first line of defense in finding a breast cancer. And now with 3D tomosynthesis mammograms being utilized throughout Connecticut, our ability to detect cancers is even greater. But for women with dense breasts, screening ultrasound serves as a complement to the mammogram, as those small cancers, as you alluded to, can really hide in that dense tissue. And believe me, I've seen it firsthand. Up to 30% of breast cancers can be missed on a screening mammogram alone. That's a significant number. However, when mammograms and ultrasounds are used together, we have the ability to better see through that dense tissue so that we can diagnose a cancer earlier and at a stage where we can potentially cure it. And we also know that some patients are at higher risk for breast cancer, whether it be due to a family history or other factors. And in these cases, breast MRI really does serve as an added layer of detection. And these imaging studies are not just for screening for breast cancer. About 10% of our patients require additional imaging after an initial exam. And that may include a specialized type of mammogram called the diagnostic mammogram, or an ultrasound, or an MRI. And this combination of studies helps us define the abnormality and then decide what type of management should ensue. I commend Congresswoman DeLauro for taking the steps needed to allow improved access to these life-saving studies. It's unfortunate that even with insurance, the out-of-pocket expenses that go along with these tests can really be debilitating for patients. This is an all too common theme in my practice. The Find It Early Act removes that barrier so that women can have access to the care they need without limitations. Thank you for your time.
Thank you. Really, just a thank you to the medical profession, and I listen to you and the statistics, but the new technology and what we can do and so forth. So just we need to continue to provide you with the resources and the wherewithal to be able to utilize the technology. Let me just take a moment to say a few words about our next speaker. I have had the good fortune to know and to work with Dawn and her family for many, many years. Dawn's family has known the heartache of losing loved ones to breast cancer. I worked with her grandmother, Phyllis, in the days of the Community Action Institute, part of the Community Progress Incorporated all those years ago, a vibrant, wonderful, caring woman who was one of my dearest friends. And I've worked with Dawn's mom, Linda. And Linda founded Sister's Journey, which is a remarkable organization that not only keeps the memory of her mom and her grandmother alive, but she provides hope and strength to those who face their own battles. And it is focused on Black women who face this issue more so than anyone else in our society. Dawn.
Thank you, Rosa, for this opportunity. There's no accident that we're here today. This first meeting was rescheduled. My mother died on October 30th, 2003. So today is the 20th anniversary of her passing. Saturday, we had over 700 people at Mohegan Sun as we celebrated our 25th anniversary of Sisters Journey and the Sisters Journey calendar. So I want to present to you, to you, Rosa, our 2024 Sisters Journey calendar. Anyone that knows of Sisters Journey knows that it's all about storytelling and hopes to save lives of other survivors. You heard the statistics today. You heard from the professionals. The thing that I want to make sure that everyone knows, all the women that hear this today, we know to get your mammograms. We know to get your annual screenings. As was mentioned, if you have dense breasts, please get your request an ultrasound. My mother often said, be an advocate of your own body. So our professionals know to offer those, but if by any chance you're not offered a ultrasound once you're told you have dense breasts, please request it. The other thing I wanted to say is know your family history. Genetic testing is very, very important. That allows you to get screened earlier before the age of 40, which is a recommended age. But if that opportunity is not given to you, do your self-breast exams. Early detection is so, so important. Again, I thank you for the opportunity and thank you all for your professionalism and what you're doing to help create awareness of breast cancer. Thank you.
It's the 25th anniversary, so this has been just a labor of love and caring and healing. And if you get a chance, the calendar is really remarkable. It's the stories of women who have been diagnosed with breast cancer and their struggle and their faith and their faith in the medical profession of being able to provide them with a second chance at life. And that's what Sisters Journey does. It helps people to get a second chance of life. And couldn't be more happy to be with you here today, my dear. Thank you. 700 people. So didn't start with 700 people 25 years ago, but you can, it's something that you follow the principles that my mom taught me many years ago. She taught me a lot of things, but two things: don't take no for an answer and never give up. And that's who you are, Dawn. Thank you. Thank you all very, very much. I know if there are any questions, comments, suggestions. Yes.
I just have to say that if you look at the calendar in January, you'll see this young woman right here.
Ah, okay.
Don's mother-in-law.
You're picked out. Okay. Thank you. Do you want to tell us your story?
Oh,
Come on.
that's something I have not done. I was encouraged, of course, over these years. I'm, as you know, very active in the New Haven community, even though I'm a 54-year resident of Hamden. But New Haven is my heart and Hamden's my liver or something. My story was very simple, and I did not share it. I went for a normal mammogram. My doctor did a good percent of the advocating for me. I had had the same doctor for lots of years, and when he read the results of both my mammogram and the ultrasound, he insisted that I see a surgeon. And the surgeon informed me that we would watch it for a while. But Dr. Geller was insistent that the surgeon see me again and that he remove any signs of anything. And so that was 20 years ago. I've been cancer-free. I've been at all of these pink teas because Dawn is my daughter-in-law. We lost my son during the COVID. And so we're like Naomi and Ruth. In the scriptures, I go. Matter of fact, she called me at 9:30 this morning after she promised me yesterday that we were free for the next to remind me that this had been rescheduled. So here I am, supporting Sisters' Journey and all cancer survivors.
What did we do last week, Mother-in-law?
We went to about 4 different places,
Right.
at
Right.
least.
Outreaching, right?
Outreach,
Right.
and throughout the years.
Right.
That's my story.
Well, God, thank you, and God bless, God bless, God bless, honestly. And I think just the one comment, and I haven't read the whole story about Jacqueline, but she said, my motto is I don't chase illness, it has to catch me. Accept what is, let go of what was, and have faith in what will be. God promised us life, and I believe him. And I'll just say that, as I started, it's by the grace of God
Oh, yeah.
that we are alive, but also it is biomedical research and it's the medical profession that really embraces these efforts. And you've heard Jacqueline's story about the surgeon insisting that she go back. So we're so, so grateful for the work that you do in helping to keep us alive. Thank you so much. Thank you, my friend. Any questions?